So I have some time to discuss the previous talks, and let's say the first three about the nerve around the shoulder. Any specific remark, any question, something? All right. We have know very well what to avoid and what to expect. All right, let's go for the more clinical situation now about the evolution, the second talk of Chrysatos Chrysanthou, the evolution of shoulder arthroplasty and where we're now. This is an historical talk, let's say, okay? And you want somebody for the audience to ask? No? Okay. And let's go for the Professor Girvasi, the anatomic shoulder arthroplasty. Any remarks? Yes, Dr. Marianovic.
I would like to ask a little, the young patient who will need further operations, what is your opinion about metal base plate? Because they allowed us to do something in the future, but from the information we have from the past, we know that this is not the ideal.
Yeah. So you have several options. One is a biological resurfacing. I will try to show in one of the next presentations. But these are promising, but they don't maintain what they are what they promise. I tried with meniscus, lateral meniscus allografts, and some of Achilles tendon. There are short term because we are talking about young patients, so not young as 60 years old, but young as 30 years old, 40 years old. So their life expectancy is too high to consider performing properly a graft that lasts 3 years. So, and there's a Mayo Clinic study years ago that assessed the possibility of this biologic grafting. And the biologic grafting is not tested to last so many years. So you have to go to or hemi, and the hemi poly, so the pyrocarbon can promise, but cannot, is not stated that it will last more. And you can go for normal polyethylene, but polyethylene and cement, they over the years they cannot last. So this is really a problem, and we today have to deal with several surgeries. Metal, I think this is not the option for a young man. I would choose other, but the best for them is to lessen their functional request. This is the only thing you have to say. No anymore sport activities. Oh yeah, if they live for that because this is the only way they earn, they can give that and they can lose their functional expectancy over the years.
Okay. Professor Levy, you want something to add?
Yeah, we published a few years ago on 10 to 25 years with resurfacing, with pretty good results when we did a microfracture of the glenoid, because we used to use a metal back glenoid, and we thought we solved the problem of the world because it was fixed to the bone, but we saw a very I would say rapid wear of the poly, like everyone else in all the other prostheses. So we stopped that, and we're using microfracture on the glenoid, and we had very good results on up to 25 years. It lasted nice, and it's a good option for the young patients. I think that what I want to say, and I'll present my presentation, you'll see that in there, that I think if we think about young patients, we have to think about preserving the bone. Preserving the bone because we will go back again sometime. And that's for young patients. I will do resurfacing, or I'll do a stemless implant, and I will definitely not put a stem into the shaft because this takes them only one way.
Well, thank you very much for your interesting remarks. So, going for the next.
Yes. For the next three speakers, anybody has something to ask or make a comment for Mr. Kyriakos, for the speech of Mr. Kyriakos? Do you do any stemless arthroplasties? How many of the audience have done a stemless? All right. Good. Excellent. Any comments for the speech of Mr. Kyriakos? And any questions for Mr. Sinopidis? Christo?
We are already discussing this, the arthroplasty in the younger patient, and I want to ask all the other speakers as well and offer. I mean, is there any other alternative? The case I showed you.
Yeah.
Can you do something else, not by the mean of prosthesis, by the mean of more biological or in a distracted joint though?
I think, again, you can do resurfacing. Again, you can do resurfacing. You get the same what you've got with the stem, just didn't put a stem. Or if you want, you can put a stemless anatomic, that's as well. And you can do a stemless reverse. Because this gives you, again, all the bone is there. This gentleman will need a revision in his lifetime. Maybe in 30 years, 40 years, who knows? But if you put a stemless implant, even if you put a reverse, you still have everything there. So I think it's worse to put a long stem inside, because then you committed him. You'll have to split the humerus. You have a difficult time in the future. And if you put a stemless implant or a surfacing, it's easy to deal with it later on. I mean, I'll talk about it in my presentation.
Yes.
I remember in Birmingham quite a while ago, Duncan Learmonth used to use massive calf tears in young patients, resurfacing in a valgus position in order to preserve bone and come back in a later stage and perform a reverse total arthroplasty.
It was before we had a reverse. I used to do the same. We didn't have a reverse. This is in the old days. And the only thing you could do for calf arthropathy is to put it in a little bit in valgus.
Yeah.
That's the reason why Steve at certain point developed this EAS that was complete failure, but he tried to do this EAS resurfacing.
Is there any role in that valgus resurfacing procedure in young patients when you got to deal with a lot of
No, I think if you have a stemless reverse shoulder, go for that because this will give them better results.
In day one.
If you want to drive, no offense, a Fiat Panda, or you want to drive a Ferrari.
Okay.
Both Italians.
Thank you.
So anybody else wants to ask something? Mr. Sinopidis, or make a comment? And let's go to the last speaker, Mr. Marjanovic. He gave a great talk about computer assisted in navigation. I was impressed. I don't know about you. I don't know if somebody has to make a comment or a question. And as we saw, it was a very fast procedure. If you only need some minutes to make all these calculations. Yes.
What is the cost for that setting, for that particular setting? Computer, organizing all that procedure in an operation theater, and more or less, what is the cost for the patient who's coming to pay for that from the scratch privately.
Right, Mr. Marjanovic, yes.
Yes, so the cost is just the printing. So the printing of the jigs, because the device for the navigation is one. So usually the device comes with the company. Okay, so you don't have to pay nothing for the thing. For the thing you pay is just for the for the planning, because, for example, with the company I work, they can make also the plan of the operation that is much more accurate than every other planning we can do on the computer. So their time for the patient is just a thing of you. So how you talk with the patient and to decide with him the price, because this is one answer, and the time consuming, I can say like 20 minutes for all this procedure during one operation. But you know, the time 20 minutes, but you lose the time. So you have more time because you have just one step. You find in the first time, for example, the screw position, the ideal position. You don't have to change. You don't have to move. So, for example, for the reverse, it's much faster for the more difficult case than doing freehand.
Right. I would like to ask you something. I mean, you use this technique for specific cases.
Yes. So everything was born on the femur, because they saw that it was very difficult to find the hole for the nail.
Yes.
So how you feel the nail, and then everything was evolved. So from the femur, they moved to the knee for the osteotomies.
Yes.
Then to the spine for the scoliosis, for the pedicle to the right position, and then at the end to the shoulder, because on the shoulder you have no space.
Yes, I know, but I want to ask this. You use this technique for specific cases.
No, you can use for every case.
You use it for all cases.
No, I use just for the revision.
How do you choose? I mean, you choose only for the revision.
Yes, just for the revision. But
is this because it is very expensive or another reason? I mean, why don't you use it in all? I mean, to be sure.
Because 20 minutes for the easy case,
right,
when you have already all the steps planned and you know exactly what to do.
Okay, fair enough.
It's okay. You can, but you're losing all the time.
So anybody else wants to ask something? Nice, we are on time. So you can have time for 2 coffees instead of 1. I wish you good morning. And
we ask the next chairman to take place here. Thank you very much for your patience and for the excellent talks.